So why do healthcare costs keep going up faster than inflation? The way I see it, there are two main drivers of increased money coming out of your pocket for healthcare services. This includes increasing premiums, deductibles, and worse coverage overall. First, large health insurance company profits are capped at 15%. Now, you might say at first that's a good thing, and in theory, you're right. However, in practice, it's a terrible thing. So stay with me, all right? So every company wants to increase how much money it makes, right? And specifically, let's talk about profit, which is money after your business expenses are paid. And let's use a simple example. Let's say that United Healthcare sets your premium at $1,000 per month. This means the maximum profit they can make is $150, as that's 15% of 1,000. If they can't increase their profit, what is the only way they can increase how much they make? They've got to raise your premium. Let's say they double your premium to $2,000. Now they can make $300, as that's 15% of 2,000. If they increase your premium, that means that they must spend more on healthcare services. Hospitals will then charge more, insurance companies will pay more, and your premiums will go up. It's a vicious cycle. The second major way that insurance companies can make money is largely through what's called vertical integration. Insurance companies will purchase pharmacy benefit managers, doctors' offices, surgery centers, and various other related healthcare type companies. In the case of Kaiser Permanente, the insurer also owns the hospital and pays themselves, which is interesting. And then United Health Group now employs over 90,000 physicians, which is approximately 10% of the physicians in the US. And since health insurance companies are capped at 15% profit, they have sought out ways around this to increase their overall profit margin in related industries that do not have this cap. This is why they vertically integrate. And another benefit for them from vertical integration is they can pay themselves, which comes with its own tax advantages in the form of what are called intercompany eliminations. They're able to effectively take revenue that they make from their health insurance arm and then pay their doctors and pharmacies. This money is essentially then transferred out from a profit capped business to a no cap on profit business. This is a brilliant strategy, but also a bad thing for normal people. This is why UHG can have record profits every year, while every normal person has their premiums and other out-of-pocket healthcare costs go up and up and up by 10 to 20% or more per year. And the more we pay, the more they make. It's a terrible incentive. Vertical integration isn't always a bad thing, particularly if it helps control costs and increases efficiency, but that's not what has happened in healthcare in most other companies, not including Kaiser. Kaiser does a pretty good job with this, of not letting costs go way overrun. There is another reason why healthcare costs keep going up too, and so much, and this is due to how unhealthy the population is and how health insurance companies can only create premiums based on community rating. They can't set rates based on the risk of individuals, but on the community itself. So the Affordable Care Act allowed for a modified community rating, meaning that older people can be charged up to 3 times more, and then in some states you can be charged more if you smoke. Community rating is probably the most fair way to assign premiums, as it doesn't discriminate against people with pre-existing conditions, those of which were self-inflicted, and those of which were not self-inflicted. So for people who are very healthy and were paying like very low premiums, it doesn't really feel fair and almost feels like a punishment for doing the right things to keep yourself healthy. But with that being said, from a utilitarian standpoint, this is likely the best option, as usually the unhealthiest people are not the ones making the most money and therefore can't afford the more expensive policies. So what's the solution? If we can't charge unhealthy folks more, well, it's the hard part. Get healthy. This is the part that everyone avoids because it's a supremely difficult problem to solve. If everyone was a healthy body weight and cardiovascular disease dropped by 50%, our premiums would go down by a large margin. But as I have shared in a previous video, Americans strangely want the right to be unhealthy and die early. I suppose freedom comes with the consequence of a majority of people not taking care of themselves, which is sad. And like I shared before, I don't think that the blame or all the blame lies on the individual. Our societal structure, driving everywhere, fast food, aggressive alcohol advertising, perverse incentives for health insurance companies and hospitals. You add all that together and you have several $1 trillion fighting against you to be healthy every single year. This doesn't eliminate personal responsibility, but I think it's a part of it. And when we look at solutions from a federal level, this seems impossible. But when we bring it down to your city, I think it gets a little bit more manageable. Like, for example, you could petition city council in your city to make more walkable and green spaces where cars aren't allowed. You could petition for protected bike lanes and wider sidewalks and more mixed-use zoning. These are all things that can absolutely be done and are being done around the country. That was a bit of a tangent at the end there, but thanks for watching. I would love to hear your thoughts on this. Later.